At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Digestive Disorders, the Gluten Connection, and Immune Response on Wednesday, July 10th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
This is Dr. Tom Roselle Live on 105.9 FM WMAL.
Welcome, everybody. Dr. Tom Roselle here. Welcome to Dr. Tom Roselle Live, as we do every Sunday, and we've got a great program for you. A little bit of a continuation of last week. We're going to talk about that gut of yours again. That's, the intestinal tract, that inner portion that everybody gets rumbles, and, when it's really bad, you're cramping, you're doing all kinds of things. Remember, on the 10th of July, coming up at the Roselle Center for Healing, I'm going to do a night on intestinal tract problems and what really happens, and the manifestation, a lot of different things. It can cause back pain, it can cause migraine headaches, it can cause your blood supply to be stagnant in your legs, and you get all these varicosities and so forth. So join me. And by the way, I'm going to be doing that program. I'm not going to have any sidekicks this time. Just me. Love to have you. Love to meet you. But make sure you call 703-698-7117 or go online to rosellecare.com, ROSELLECARE, or drtomroselle.com. Any of those things will do it, but you got to register. We want to be make sure that I'm properly prepared for all of you, and we're going to have some fun. I'm going to do some demonstrations. I'm going to show you what really takes place. Remember that it has multidimensional impacts, and one of them, it affects your mood. It can produce anxiety, it can produce depression, and that comes about because of what it produces internally, and that's called neurotransmitters that affect your brain. Things like serotonin and GABA and dopamine, and you name it, it's there. It produces 80% of everything that affects your nervous system, including your brain. So join me, and I'm going to show you how when environmental impacts like pollutions and electromagnetic frequencies, but your diet, that thing that none of us want to look at, but more importantly, injuries that you may have never thought about can cause a monumental effect on that intestinal area. So we're going to talk about the impact on your gut in overall general health and what that means, but more importantly, what you can do to shift it, to change it. So today we're going to get a little bit about that gut-brain connection, a little bit more, and then we're going to maybe slide into why you might have colitis, and we're going to talk about that, the irritable bowel problems that you have, and is it a disease process or is it a syndrome or what it is. I promise you on the 12th that you're going to really go away with, I didn't know that, but here's the deal. It's in your hands. You can turn it around. Don't forget to join me immediately after Dr. Tom Roselle Live and go to Ageless Health live stream. It's on all your favorite social media sites, but you can do it simply by going to drtomroselle.com. You click on that, a banner will come up. You click on that, it'll take you right in. So we do seamless. We do from our program here on WMAL 105.9 FM, and we go directly into live stream, and we make it happen because we want to continue the process of educating you at the highest level we possibly can. So join me. Don't forget. And by the way, make sure you follow me on all of your social media sites, whether you're on Facebook, you're on Twitter, you're on Instagram, any of those and more. We're on, and even Rumble, we're on tons of them. I think at this point we're on 10 different sites. Follow us so we can make sure that we get you the most important information that you deserve. Okay, let's talk a little bit about that. What's the brain-gut connection, and why do they call that? There's so many different articles that have been published over a period of time, and one that's really interesting that came out of Harvard a while back. And if you go into Harvard Medical Publishing, you'll see it. But here's the deal. The gut-brain connection, pay attention to that connection because it may contribute to huge amounts of interconnected problems from, as we said earlier, anxiety relationships and digestion problems and so forth. You wonder why people who, we're on so many different psychological drugs anymore. And we wonder why it comes about. Why do we have a society that is so emotionally sick? Well, there's an argument that because we're in an environment that we're constantly being bombarded by negativity, which is true. It adds to it. Remember, structural, neurological system, chemical, biochemical, bioelectrical, and the emotional side of the triad, the nandering, the decision making that we make, and so forth. The gut-brain connection is no joke, my friends. It really exists, and it can link to all kinds of things, from anxiety to really significant problems with your stomach and your intestinal tract and so forth. So have you ever had that feeling where that internal gut feeling is just there, and it's a kind of, you can call it a gut-wrenching experience. You can, it can give you butterflies, that area. You wonder where that comes from, right? Guess what? It's in your stomach. It's in your intestinal tract. And, how about that nauseous feeling, like you're going to feel like you're going to throw up, something must be wrong with me, I'm sick, I don't feel good. That can simply be the gastrointestinal tract is sensitive to something that's going on. It can be sensitive to emotion and causing that feeling, or that emotional situation is hand in glove. So things like anger and anxiety and depression, sadness, if you will, or exuberance, elation. It can go either way. How about people who are schizophrenic? Could it be something to do there? Yeah, possibly. And I'll show you what that means. And see, here comes up to you. What do you want to do about it? If you knew that was true, if you knew that there was a center portion of your body called your gastrointestinal tract that really contributed to your, not only your physical health and pain patterns that you might be experiencing that just don't go away, and they're causing repetitive things, and you're on tons of medications, wouldn't it be great to clean up? The other day I started with a patient, that young man, younger than me, so anybody that's under the age of where I am is young. But this young guy has been suffering from chronic pain patterns since he was probably about 15 to 17 years old. And there's a lot of different pieces of that going on. But part of the problem, and all you had to do is look, is that his intestinal system's not doing the way it should do, right? So the brain has a direct effect on the stomach and the intestines and the stomach have a direct effect. So I looked at this guy and examined him and did my normal intake. And you know what he was told? You know what the physicians told him out there? There's nothing we can do for you. You're going to have to live with it the rest of your life. That's not a good diagnosis. And so this poor guy comes in. He's on 16 different medications. And none of them are doing what they're supposed to be doing. And on top of that, he's getting some IVs to try to help him. He's on some extraordinarily addictive drugs. And the poor guy has a shaking pattern. He has clamminess to his skin. He goes into sweating patterns. He hurts all over. He was told that he had fibromyalgia. Well, if you've heard me lecture, you know that fibromyalgia is something that the medical community will say you have when they don't know what else to call it. So if that's true, wouldn't it be useful to be able to pick the body apart and really understand the interrelationship? Well, when we dug into this young man, we also found that when he was a young boy, he had very significant emotional trauma on top of that, one that none of us should ever sustain. And so that began to lead into other patterns, and other patterns began to reinforce that. And this poor young man, is sick and a loss of an extraordinarily potentially productive life. But I promised him that if he became my partner, meaning do what he needs to do, that I would help him through the process. I gave him my cell phone. I said, text me. You got a question? You text me. And by the way, I do that with all my patients once they go under care, because what we do is so different that they need to have explanation. And I'm the guy that wants to explain everything to you and make sure that you get it done. We always give you a choice. Can you say yes or no? But the choices I give you will have a positive outcome if you do them. And it's no different, and particularly in the situation when we're talking about and how the intestinal tract and your mental health go hand in hand. So, the brain has a absolutely direct effect on your intestinal system and your stomach. So the very thought sometimes of eating releases what? It's like Pavlov's dog. You're going to release all your digestive juices before they get there. So that connection goes both ways, right? A gut can send signals to the brain, and the brain can send signals to the gut. But then they, in turn, because of their interconnective pieces that they have to produce, can cause other problems within the body, from extraordinarily severe, significant pain, whether it's a headache or whether it's a joint pain that's swollen. But the anxiety, the stress, the depression, all those things are intimately connected with the gastrointestinal tract. Now, when we talk about the gut health anxiety platform, we have to really understand both pieces of it. But it becomes, when we understand it, it becomes really understandable why you might feel nauseous, giving certain types of exposures and presentations. Emotionally is what we're talking about, right? We feel the intestinal pain, sometimes because of stress patterns that just don't go away. We internalize it. You hear that gut feeling. There's a lot of people that we see recently that, because of what we've gone through over several years now, and the stress patterns, the oh my God attitude that they developed over time, they say, I just don't feel well, and my intestinal tract is just giving me all kinds of trouble, and I'm cramping, and I just kind of hurt all over, and it's never happened to me before. And what can I do about it? Well, the first thing is that we have to rule out, other things, but judiciously rule them out. Make sure that you understand what the connections are, not just rule out and say by default this is what it is. No, we have to rule out, but then we have to rule in. We have to make sure that we understand the intimacies. So you might expect, at least some patients with these problems, these functional gastrointestinal conditions, and I say functional because they're not tumors, they're not pathology, it's not bleeding. But by the way, gone too long and really undiagnosed properly, you can have those things. They can show up. So we have to look at the pieces of the puzzle. We have to look at the emotional platform, and we have to look at the physiological platform. We have to look at the dietary pieces. We have to look at the connectiveness of the nervous system. You have a nerve called the vagus nerve. It's the 10th cranial nerve. You've heard me talk about it continually. Why? Because it connects everything in the body. There's nothing in an organ system that it doesn't touch. So if that nerve, that vagus nerve, that 10th cranial nerve is irritated because it's swollen, it'll affect all kinds of things. But today we're talking about your stomach, your gastrointestinal system, your colon, and so forth. It touches all those pieces. So, is your stomach and your intestinal tract, is that heartburn that you have, is that cramping that you get, is that diarrhea that you get, or conversely, the constipation, that you go on and on with, is that a result of physiological problems that are unidentified, or are they a result of the emotional connection to the different parts of the body? The short answer is yes and yes. So we have to figure it out, and they go hand in hand. So we have to figure out what the problem is and where it's coming from. If we don't do that, we have a monumental issue that just never seems to go away. But when we start digging in the literature and we start looking at the connective patterns of everything, it's really amazing that people didn't get this before this. And instead of trying to fix it and get people to understand that they have the the ability to resolve this, we just do what? We throw medications at people. So how do we identify that gut feeling? When do we have to trust our intuition? That's another piece I'll get into. That you have that intuitive sense. That's your gut, by the way. So feeling uneasy or uncomfortable with a decision or situation, it can often be your intestinal tract not working the way it's supposed to. Repeated ideas or thoughts about certain topics. You just kind of dwell on them. It's going over and over again. Experiencing horrible dreams, lucid dreams. Guess what your gut produces more than any place else in the body? It's called melatonin. Melatonin is at a greater level of production in your gut than any place else. Feeling all of a sudden inspired or motivated about something, it can be your gut too. Why? Because your gut produces something called dopamine. Dopamine is the motivator. That's the, let's get out and do it juice type of thing. So if that's true, are we not looking in the wrong place when it comes to fixing some of these things? I think we are. How about these joints that swell? Where does that swelling come from? Is it because we got some invader that's floating around into our bloodstream well, it can, but where did the invader come from? It could be the gut. If the intestinal tract is permeable, you're absorbing a lot of these things in your system. So we have to really get it. I'm going to show you on the 10th how you can pick this thing apart. But more importantly, I'm going to show you how you can solve some of these problems. So that gut-brain connection, the irritable bowel syndrome, the things that are showing up on an ongoing basis is no joke, my friends. It's something that you really have to put together. There was another article that I found extremely fascinating. It came out of Loyola Medical Center, and it was talking about how your brain and emotions control the gut. And this was not an MD that wrote it, but she was a behavioral medicine specialist, a gastrointestinal behavioral medicine specialist. And her name is Sarah Kissinger. She's a PhD, and she's all about digestive health programs. She's director of gastrointestinal behavioral medicine at Loyola, and as far as I'm concerned, one of the best medical places around. And she talks about what it is, and she went in and even above what I usually will say. She said, obviously the gut is the second brain. It's named that way for a lot of different reasons. And she says that 95% of that serotonin, that feel-good juice, is produced and found in your intestinal tract. So guess what? If the gut's not working the way it's supposed to, you're not going to feel well. You're looking at the environment as always being half empty. So if you want to feel that the environment is half full and everything is cool, you've got to go to the gut and diagnose it along with other things. Now, if you go to my world, the world of applied kinesiology, the world that I treat in functional medicine, here's the deal. That the organ system, regardless of what the name is, this time we're talking about stomach and intestinal tract and so forth, and other things have connections. What are those other things? We're talking about muscle patterns. The intestinal tract, the stomach, the large intestine have connections in the structural muscular skeletal system. Your thigh muscles have to do with small intestine. Your hamstrings have to do with the colon. The muscle on the outside of your leg, the iliotibial band, has to do with the colon. And it could go on and on. Your biceps, you do curls with, those beautiful Hollywood muscles guys like to have, that's stomach function. And there's a very specific neural connectiveness to that. But that same nerve that goes to the muscle goes to the organ. And we're going to talk about that on the 10th, and I'm going to show you how that works. So, as you go through that article in Loyola Medical publication by Dr. Kissinger, she talks about a lot of connections with irritable bowel syndromes and Crohn's disease and ulcerative colitis. And, back in the day when I was an intern, going back a long time ago, as my children would tell you, when the dinosaurs ruled the earth, there was a young man that came in, and I'll never forget him. He had 30 bloody bowel movements a day. This guy was emaciated. He went from a kid who was about 190 pounds, and when I met him in the office, in the clinic, he was 130, 135, and he was a very sick young man. And we identified several things with him. But to fix him, we had to fix the entire intake, intestinal system, immunological reactions, but we had to also upregulate a lot of his feel-good juices, it's called the neurotransmitters, not by giving him things artificially, but by supporting the body's capacity to be able to do itself. So when you know that these things exist and the far-reaching impact that it has on your body, wouldn't it be great to be able to understand it completely and to be able to turn every major institution anywhere that has any decent reputation, from Loyola to Harvard, Johns Hopkins. The researchers at Johns Hopkins found evidence that, the irritation of the gut are sending bad signals to the central nervous system and can cause pain patterns and emotional reactions and things of that nature. So why are we ignoring it? Why are we not doing what we need to do and fixing the intestinal system and the neurological system that goes through it, and get that to upregulate and turn these things around? Let me tell you one of my suspicions. We are so inundated with marketing. Eat this for that. We forget about how these things are raised. We forget about that the God-given vibrancy of what food should support has been taken out. And so subsequently, we're eating artificial this, genetically modified that, things that have not been raised organically, and they have a huge impact across the board. Scientists, and this is out of Johns Hopkins, they said that the brain, the enteric nervous system, okay, this little brain, okay, the gut, from the brain, body, gut, brain connection, it's not so little. And it has layers of more than 100 million nerve cells that line your gastrointestinal system from your esophagus all the way down to your rectum. So if those guys aren't working the way they're supposed to, you got all kinds of bad stuff taking place. But on the 10th of July, join me. We're going to have some fun with this. I'm going to show you some things that you didn't expect to see. I'm going to show you the intimacies of what happens. Do you know that over 60% of you have parasites, and they're just kind of hanging out and they're living in you because we all like our sushi, and we eat things that are not cooked properly, and we eat pork. If you eat pork, by the way, it's not a matter of if you're going to get a parasite, it's a matter of when. And simply that's because of the fact that, they have to use all kinds of things to stop the parasite within the pork to manifest rapidly. See, because when you lot raise a pig, they eat where they dump their stuff, right? And guess what? You're getting that stuff back into your body when you eat them. That's just the way it works. It's like nursing from a mother. Yeah, I know. I can get a little graphic once in a while, but you need to know the truth. Let's make it happen. And if we don't pay attention to it, we have a society that will continue to get progressively sicker over time. People during COVID who had good nutritional balance, they didn't get sick. We're going to come up to that place of the puzzle today's program that I wanted to tell you. Make sure that you join me as soon as we're done here at drtomroselle.com or on any of your social media sites that you've logged in to follow me. And we're going to continue the process of talking about some really interesting things. We're going to start tying other pieces of this puzzle. We'll talk about the release of enzymes, but also, what you really need to know about when it comes to these different problems. And I promise you on the 10th, we're going to have a great time. Please join me. It's going to be a lot of fun. And you know me, I can't shut up. I'll be there for longer than what I expect to be and try to give you all the things that you need to know, from everything from behavior patterns to pain patterns to why things don't go away. I promise you that's what we're going to do. We're coming up to the end of the program. Remember, I'm here every Sunday for one reason only, and give you the data that you need. Simply this. I love you all. You have a great Sunday. We'll see you in a couple seconds on Dr. Tom Roselle live stream.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. If you are in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Call 703-319-6990 for a complimentary consultation or visit bestinsmile.com. That's 703-319-6990 or visit bestinsmile.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Digestive Disorders, the Gluten Connection, and Immune Response on Wednesday, July 10th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.